city of Boston will not move into the next phase of reopening. The mayor saying the rate of infection is increasing and the city may soon become a red community, a high-risk one. Here to discuss it with us is Dr. Daniel Koritskis, chief of the Division of Infectious Diseases at Brigham and Women's Hospital. Good to see you.
Good to see you, Emily.
So, Dr. Koritskis, at the same time that Mayor Walsh says that today, the governor is touting the state's low infection rate this week. So is something happening in Boston that has them heading in the wrong direction?
I think we've known for a long time that there are certain pockets of infection in Boston that continue to be higher than in other parts of the state within particular communities, and also perhaps because of the large number of college and university students who returned to the state and may be spreading infection on their campuses.
And that was the suspicion the mayor voiced today, those young people under 30. We're also seeing more school districts move to all remote learning following infection concerns because of maybe parties, other gatherings. What do parents and their children need to consider about following precautions? Because this really is not just about their health.
It's not just about their health. I think everybody agrees that whenever possible, in-person learning is better. And so it's everybody's responsibility to abide by the precautions to allow that to occur. In addition, all of the students have a responsibility to the entire community, all of their teachers, the people working in the schools, and the others in the surrounding neighborhoods to keep everybody safe.
Right. We all need to remember it. Let's talk about this study that was published today. It shows that the vaccine from Moderna, they're based in Cambridge, it produced 3 times the antibodies in people over 70 compared to those aged 56 to 70, and then similar levels of antibody to younger people given the vaccine. So this was a small one, just 40 people. Is this different than what we have seen in other tests, and is it better?
I think what's really encouraging here is that we saw really robust levels of antibody production in the oldest participants in the trial. We know that with flu vaccine, we often see weaker immune responses in older people. And so seeing such good responses with the Moderna vaccine is really a very encouraging result. We'll have to see how protective it is, but at least so far the data look good.
And they might be some of the first to get the vaccine if it was approved. All right.
That's right. Older people are targeted for vaccine.
All right, Dr. Koritskis, thank you for your time. We really appreciate it as always.
You're very welcome.